Good morning, everybody. This is Suicide Prevention Month, and I know that suicide is one of the most difficult things for anybody to deal with, for the families and loved ones of the person who commits suicide, and for the torment that people go through that brings them to that point. We know this is a tragedy. These are lives that are lost that don't need to be lost. And it deeply affects people in our community. And we also know that in the time of COVID, that the stresses that have been put on people are greater than ever, that whatever made life difficult and troubling before has only been exacerbated by the conditions that people are all living in now. And we're aware of that. And in that sense, it makes this year celebrating this month, or acknowledging this month, and also acknowledging the work people do becomes even more important, because we are the eyes in the community on our friends and on our neighbors, and we're likely to be the first ones to see signs of a person's distress. And so it's important to have that awareness. And I want to do a proclamation, and I think we'll take turns, Gabe. We'll do this. We'll switch the whereases off, right?
Yes, the three of us will.
The three of us will. Okay. Yeah.
But,
okay. Yes.
But we're going to ask Gabe to say a few words now, too. Please, Councilmember Albornoz.
Thank you, Mr. President. I'll be brief. The county executive did a great job giving a highlight of why this is such an important day. But, as we're trying to protect our mental health and trying to cope with the overwhelming uncertainty that we're all feeling right now, it's more important than ever that we're here for each other and that we take the steps to raise awareness, work to destigmatize suicide and mental illness, because we know it's important to ask tough questions. If one of our friends or loved ones is in emotional distress or pain. I want to take a moment to acknowledge Dr. Raymond Crowel, who prior to serving as the director of the Department of Health and Human Services, led very ably our work around suicide prevention and behavioral health as a division chief within the Department of Health and Human Services. And he represents the kind of professional that is on the front lines, helping to support families across our community. And I also want to acknowledge the incredible community-based organizations and nonprofit organizations and staff of Health and Human Services who work so tirelessly on behalf of our communities every day. It is more important now than ever that we come together as a community to address the issues that lead to suicide and support our community during this very stressful time.
Thank you. And I'm not going to be very long on this either. I'm going to ask Dr. Crowel if he had a few words to say afterwards as well. But, this, in many ways, suicide has been said time and time again, is a horrible situation for everyone involved in it. The person who ultimately decides to do that become a suicidal person obviously affects their families. They affect every loved one they've ever met, their neighbors. We all need to band together to do our very best to help prevent this. And we're doing, in some ways, a better job. We have more mental health workers. In Montgomery County, we're certainly looking to do an even better job beyond that than what we're doing now. But many times someone figures that this is the way that they're going to solve their problems, and they're not. This is not the way. They don't want to lose their life. They want to lose their problems. And if you let all of us come together to figure out how to help, and we do, everybody has problems. If you let us come together and let us help, it can mean so much more. To think that no one ever wants to smile again is a very tough thing for all of us to think about. So I applaud everyone who is working in this field. I applaud everyone that steps up. I applaud everyone who thinks that when they know of a person who is being troubled and has troubles, that you let all of us know so that we too can help. And with that, Dr. Crowel, did you have a few words to add as well, please?
Sure. Thank you, and I'll be brief in the interest of time. And thank you for taking the time to do this proclamation. In a couple of numbers around this. In 2018, there were 48,000 people who took their lives, who committed suicide. And in this world of COVID-19, where we're fast approaching 200,000 people whose lives have been lost due to this, it doesn't seem like a big number, but that is an incredibly large number. It's the equivalent of a jumbo jet crashing every week in this country, fully loaded, just to give it a real physical context. But it's not just last year, 2018. That happens every year in this country and has been happening every year for decades. And those numbers have gone up recently. That 48,000 is a higher number. It's a time for us to remember, and I'm grateful for you all taking this time to remember that even in the face of all the things we're doing with COVID, people are still suffering. People are still in pain, and they still need our help to get through that. And this message, our message, should constantly be one that there is help, that it can be, that there is a path to a better way, that suicide is not an answer to a problem. So, and I want to encourage folks who may be listening or may have a chance to hear this to be the one to ask the person who's in trouble to keep them safe in a time of trouble, to be there for them in any kind of way that you can, to help them connect, and to make sure that you follow up with them, to make sure that they're not alone out here, and that there is support and there are people who care about them. So thank you all again for this moment.
Thank you for all that you do and your department. We sincerely appreciate it. With that, County Executive, would you like to start off by reading the proclamation?
Yes, I would. Thank you. Whereas suicide is a leading cause of death among all age groups and is the second leading cause of death among individuals ages 10 to 34. In 2018, 48,344 people in the United States and 650 in Maryland died by suicide, as reported by the Centers for Disease Control. And
Councilmember Albornoz.
Whereas mental health plays a crucial role in overall health and well-being, the prevalence of behavioral health disorders in Montgomery County is significant across all communities, including mental illness and addiction. And whereas
increased isolation and anxiety resulting from the COVID-19 pandemic have exacerbated behavioral health problems, increasing risk of suicide and overdose. And whereas
increasing deaths from suicide and drug overdoses are damaging to individuals, families, and the community. A single suicide loss affects, on average, 115 people. And
whereas a knowledgeable, informed, supportive, and welcoming community can save lives by combating stigma and taking action to promote the mental health of everyone using interventions that are evidence-based, collaborative with consumers and families, and focused on strength, resilience, and hope, including promoting wellness, preventing mental illness and addiction, actively treating mental illness and addiction, and supporting the recovery of persons affected across their lifespan, will decrease risk of suicide and overdose, resulting in thriving youth and families. And whereas
organizations such as the Maryland Suicide Prevention and Early Intervention Network, MD-SPIN, and the Governor's Commission on Suicide Prevention resolve to integrate and coordinate suicide prevention activities across multiple sectors and settings, develop, implement, and monitor effective programs that promote wellness and prevent suicides as an aspirational, it prevents suicides and related behaviors, promote suicide prevention as a core component of healthcare services, promote the adoption of zero suicides as an aspirational goal by healthcare and community support systems that provide services and support to define patent populations, increase the timelessness and usefulness of surveillance systems relevant to suicide prevention, and improve the ability to collect, analyze, and use this information for action. Now, therefore, do we, Mark Elrich as County Executive and Sidney Katz as County Council President, hereby proclaim, along with Councilmember Albornoz, hereby proclaim September 2020 as Suicide Prevention Month, and we call upon residents, government agencies, public and private institutions, businesses, and schools in Montgomery County to commit our community to increasing awareness and understanding of mental health, the importance of protecting their mental health, and the need for appropriate and accessible behavioral health services for all residents. And it's signed today by both County Executive Elrich and myself. Thank you all very, very much for all that you do, and we appreciate you being here.